ready, but it's just to make a quick mic check.
Yeah. 1, 2, 3, 4, 5. This is Beth giving you a mic check.
1, 2, 3, 4, 5. This is Adrian giving you a mic check.
And so it's going to be tempting to look there, but we're going to want to look there.
Yeah,
Actually, at this point, we can
You want to turn that off?
Turn
Yeah.
it off,
It'll be a
right,
little
yeah.
distracting.
We're no longer using anything
Perfect.
from it. Okay.
Okay.
All right, control room's good. You good? All right. 3, 2.
Hi, everybody. Thank you for joining with us. I'm the Fox Medical Team's Beth Galvin, and I am joined by Dr. Adrian Tyndall. He is the Dean of the Morehouse School of Medicine. He's also Executive Vice President of Health Affairs for Morehouse School of Medicine, and thank you for joining us, first of all. And Dr. Tyndall is a longtime career emergency physician, and so we're going to have you wear that hat today, if it's okay with you. And we're going to be taking your questions for Dr. Tyndall. Just leave them in the comments section, and I'll be checking my phone and asking your questions to Dr. Tyndall. So let's start out with, first of all, for a lot of people, it's a tough decision of, do I go to the emergency department? Do I not? What are the kinds of things that, would really say to you, I need to go to the ED?
Well, first of all, thank you for having me. And I will say that sometimes those decisions are made for you because, as you might imagine, no one wants to be in the emergency department or the emergency room. But when you are there, it is potentially for very significant reasons. So we have seen all too often on the news reasons for people going to the emergency department. We recently saw the tragic event in the field with a cardiac arrest that actually occurred, right? I mean, these are obvious reasons where you get taken to the emergency department. But when we think about why you might want to access care in the emergency department, we think about things like cardiac events or strokes or severe pain that really you cannot necessarily identify what the source might be. There is always a concern for these acute events and what that could be, certainly. And whenever those things happen, we really have a couple of very clear bits of advice. One is that if you have concerns, you call your physician if you do have one. But if you're experiencing chest pain, if you're experiencing stroke-like symptoms, weakness, or any of that, if you are experiencing nausea and extreme vomiting, any of those significant symptoms will have most people call 911 or potentially visit the emergency department to see what's going on.
And so if I am going into the emergency department, really what should I expect? How does the system work?
So the emergency department is a really interesting place because when we think about emergency care today, we recognize that a small percentage of people are going there because of really substantial emergencies. Another subset of folks actually go there because they may have a severe emergency condition, but they simply do not know. So when you actually get to the emergency department, you're often greeted by a nurse or sometimes even a physician who is at the triage area. And they will actually take a look at you, take vital signs, and they will determine whether or not your condition really meets the requirement for really to be seen expeditiously by an emergency physician. And so you go through a process of triage where your symptoms are assessed, your vital signs are assessed, and you really are put in a category of priority as to whether or not you need care immediately or whether that care could be delayed because other people may have priority because they may have more emergent conditions. And so for those reasons, you get triaged in categories and based upon your symptoms and based upon your need, you will get seen in a timely manner by an emergency physician typically.
And if you have questions for Dr. Tyndall, please leave them in the comments section and we'll try to get to as many as we can over the next few minutes as we talk about sort of emergency medicine, what to expect, when to go to the emergency department. And, once the nurse or the physician sort of triages me, typically, or it has been my experience, you go back and wait in the waiting room, right? Because now you're in the queue of
Yeah.
Unless you're,
Well, it depends.
Right.
I mean, and I think that's the critical issue to understand. If you truly have an emergent condition that's really designated by the triage physician or the nurse as really requiring expedited care, you actually get taken immediately back and taken care of. You might get bloods drawn, you may get a series of tests, but you will be examined by an emergency physician to really understand what may be happening. And the point of the emergency department is that when those tests are needed or any kind of investigation for your medical condition is needed, it could be done right away. And that's the key part of why emergency medicine has been, I think, so valuable in the healthcare system today.
And then, it has been historically always busy. Now, emergency departments are overcrowded, especially in Metro Atlanta right now with the closure of Atlanta Medical Center, impacting other, major medical centers like Grady. What, any advice on sort of navigating the crowding?
Well, let me say a few things. First of all, one is that there's no question that emergency care across the country really represents a significant safety net system. And we've seen this in Atlanta with the closure of the Wellstar hospitals in South Atlanta. And this has resulted in significant crowding and really increases in volumes, I think, of all emergency departments across the area. And very significantly also at Grady Hospital, where we at Morehouse have a very special relationship with, obviously because of our faculty and our trainees who were there. Grady Hospital's emergency department has always experienced significant volumes in crowding, and also because of their trauma services, and this has also been a significant issue with increases in volumes because of the hospital closures, and we've seen this in other spaces across the country. I will say this, hospitals are working really hard to manage those volumes, and they have to do that by ensuring that at the very front they are taking care of patients who really need to be taken care of expeditiously. Safety is always on everyone's concern. But the other issue here, which is really important, is that much of what we see in emergency care today are potentially preventable. And what do I mean by that? I mean that there are circumstances and situations that exacerbate beyond the level or capability of, let's just say, a primary care space or an urgent care. That's where actually folks end up going to the emergency department. So we have to think about this holistically. The first and most important thing is to think about preventative measures. How do we actually prevent the chronic condition from exacerbating to a point that requires an emergency department visit, which is really very key. Now, if you have to go there, I think there are a couple of, common ideas to think about. First of all, if you're experiencing any of those symptoms that suggest that you have to go to the emergency department right away, you call 911, period. Okay? You call 911 because you need to be ensured that you actually get expeditious care, or at least to be triaged to ensure you don't have a true emergency medical condition.
And when we talk, Dr. Tyndall, when we talk about why you would call 911, what do those conditions look like?
And those conditions, as I said, if you're experiencing chest pain, you may be having a heart attack or a cardiac event, okay? If you're experiencing stroke-like symptoms, and we understand what that means, significant weakness in one side of the body, and the inability to talk, confusion, any of those things really require a visit to the emergency department. Increasingly, we're beginning to see issues of significant mental health conditions that result in folks going to the department, difficulty breathing. These are numbers of symptoms that require people typically to call 911 simply because they need to access that system expeditiously. Now, that being said, one of the most important things that also can be done short of those symptoms is to call your primary care physician or go to an urgent care that may be less crowded, or call ahead to ask or understand whether or not the system is crowded or what the wait times might be. A lot of departments across the country, frankly speaking, have gone to the process of actually posting their wait times to understand how long it might take for someone to be seen. But what I want to be sure that people understand is that if you have an emergency, and a true emergency, those wait times do not matter. because we have to be seen expeditiously.
And they will see you, yes. And so if you have a question, and if you're just joining us, I'm the Fox Medical Team's Beth Galvin, live in the Fox 5 Digital Center with Dr. Adrian Tyndall. He's the Dean of Morehouse School of Medicine. He's also a veteran emergency medicine physician, and we are getting some questions. So if you have a question for Dr. Tyndall, please put it in the comment section. So Dr. Tyndall, we have a question from June. She says, what's the difference between heart attack and stroke symptoms?
Well, heart attack is something very different from stroke. A heart attack is a cardiac event, okay? It is when you have problems with perfusion or the flow of blood to the muscles of your heart. When that happens, people really experience a constellation of symptoms. The first symptom they would experience is pain, and significant chest pain. Sometimes that could be accompanied with jaw pain. But sometimes, and oftentimes in women especially, those symptoms could be atypical. So you might experience nausea, you might experience shortness of breath. All of these are telltale signs of cardiac event. Now, a stroke, the same etiology. It is as a result of a lack of blood flow, but not to the heart, to the brain. And when that happens, then all kinds of symptoms can actually occur. Typically what you see is significant weakness or maybe paralysis in one side of the body, which is typical of certain types of strokes, but you might have trouble speaking. You might have trouble feeling or sensing. You may have problems with your movement. You actually might have blindness. There are a number of symptoms that people can experience with strokes. And it really does also depend. There are another type of stroke that's called a hemorrhagic stroke. Instead of a decrease in blood supply to the brain, you actually have a hemorrhage or bleeding in the brain, and that's a different type of stroke that can cause another series of constellation of symptoms. But those symptoms and signs tend to be devastating. And it is really important for the public to understand the symptoms of stroke and symptoms of chest pain. And with that level of, I would say, health literacy, we can actually do a lot better in terms of getting people to the emergency department and really saving people.
And I just know from experience, you know, you hear a lot of stories about people who may be having a stroke who may not understand, you know, that that's what's happening, and it's somebody else who notices, their wife, their partner, their husband, you know, notices, you know, you are looking asymmetrical, you're not speaking clearly.
I could not tell you the number of times that has happened to me in practice where very clearly a family member or a friend or a loved one actually picked up the symptoms that someone was actually having a stroke and got them to the emergency department where they can actually receive the care that they actually needed. So it is incredibly important. It is the very same thing with regards to cardiac events. We know that when a population not only has experience but really has been educated about cardiac events and cardiac arrest, and understand how to do CPR and understands how to use an AED, all of this becomes incredibly important in saving lives. And I think that education of our population really becomes important and to the public and to the community. And this is something that I think is important for us to do all across our medical establishment, and this is something that is important for us to do at Morehouse School of Medicine. And what we saw on the football field that was so tragic, you know, just about a week ago, I think really establishes and emphasizes the point that we need to understand what can happen, but most importantly, we can understand those things that we can potentially do to save a life. And there are many things that any of us who are not physicians can do to save a life when we see something like that happen.
And we have a question for you, Dr. Tyndall, from Deanna. She says, you know, why do we hear so much about heart attacks and blood clots? Are they related?
So they are, and I will tell you why. Heart attacks oftentimes occur from a few things that happen in the vessels surrounding the heart. One is that we've heard a lot about atherosclerosis and the narrowing of blood vessels, which is typically the reason why people develop cardiac disease and actually get heart attacks. But the thing that really creates that event is typically a clump of platelets or a clot that just creates a stoppage in that vessel and blocks the vessel and blocks the blood from actually moving through that vessel. And that is really what stops the blood supply to the muscles of the heart and creates that cardiac event that we hear about. And so when we think about blood clots, absolutely, that's part of what happens in a cardiac event. So one of the things that we actually do in the emergency department when this happens is that we actually do two things. We give medicines in the department to help to break up those clots immediately, to help to break platelets immediately. We hear about the use of aspirin. That is used actually acutely in taking care of a cardiac patient or a cardiac event. And then oftentimes in most hospitals now across the country, patients are taken expeditiously to the cardiac cath lab where they can insert a catheter to open up those vessels again. But blood clots are absolutely part of the pathophysiology of cardiac events, so absolutely right, spot on.
Okay, and then Lindsay has a question that's a little bit off topic, but she says, you know, I had the J&J vaccine, COVID-19 vaccine and booster, but J&J is no longer an option for a second booster. What should I do?
So it is very clear now that for second boosters, we can use any of the mRNA vaccines, and I would encourage that be used, certainly.
Okay.
So both of the mRNA vaccines that are out there, whether it's from Moderna or Pfizer, I think are vaccines that can be used as a booster. Okay. And I absolutely encourage that be done to really maximize protection both for you but also for those who are around you and your loved ones.
Okay, and then we have a question for Sam, and if you have a question for Dr. Adrian Tyndall, he is the Dean of the Morehouse School of Medicine and a veteran emergency physician. He's taken your questions here, so leave them in the comments for him, and we'll try to get to as many as we can in the next couple minutes. Sam says, you talked a little bit about an urgent care. She says, Sam says, should I go to an urgent care linked to a hospital? Many hospitals have their own, urgent care systems. What do you think about that?
Well, I couldn't tell you whether or not that may be better for you or not for your situation, but I could certainly provide some advantages or disadvantages or perhaps some insights. If an urgent care is linked to a hospital, it is very likely that if there is additional care needed, there's less complexity in getting you transferred from that level of care to a higher level of care in a hospital setting.
They already have your images.
They already have
things.
your images. Yeah. It is very easy then to create a pathway to get to the hospital, get to the emergency department if further testing is sometimes needed. And oftentimes, if it belongs to the same hospital system, oftentimes those physicians may know each other. It just creates perhaps an easier passage should someone need a higher level of care. And I think that's perhaps where there might be some advantage. But you know what? Urgent cares are valuable. They're important. They oftentimes provide care when needed, especially at times when convenient. And so, and really should be providing a standard of care across the board, regardless of whether they belong to a hospital system or whether or not they're standalone.
And, if you put yourself in the patient's shoes, if you're having something that, what would be something that maybe you would utilize urgent care rather than the emergency department for?
Well, if you have a cold or a sore throat, or you have fevers or mild symptoms of some kind, where perhaps if you have a primary care doctor, you're unable to see that primary care doctor, but you need to at least find out what might be happening, getting to an urgent care oftentimes would be better and simpler than going to an emergency department where obviously there might be more crowding, and because of your the symptoms that you have, you're less likely to get expeditious care. So going to an urgent care for that matter might make a lot of sense. And I actually have gone to urgent cares for a number of those reasons, right, in the past. And a lot of it too is because of the convenience of it. This often happens. Primary care offices oftentimes are fully scheduled with patients and may not be able to have folks who actually come who need to be seen very quickly. So urgent cares do fill a gap and have a role in how we actually are able to manage unscheduled care.
But if you are having an acute emergency, it might slow you down to actually go to an urgent care because they may end up having to call an ambulance and sending you to.
Absolutely. And there are times when individuals may not necessarily have a choice simply because of timing and really would want to just have someone see them very quickly. And if they have the types of symptoms that suggest that they're significantly ill, yes, they will need to be transferred to an emergency department, for sure.
And I have another question here. This is from Sean. Says, I've had 3 COVID-19 shots. Do I need another? I'm not sure. It doesn't distinguish, that they've had the Omicron specific booster.
So, it's always a good idea, and it's a good idea to actually get the Omicron-specific booster because that actually is a vaccine that has actually evolved over the older vaccines, and so I think it's important to do that. Here's the other thing that's really important about boosting. We know that your immune system does react positively to the vaccines when you initially get that, but that reaction wanes over time, and so over time your immunity actually begins to decrease. So the purposes of boosters is to really begin to sort of recharge your immune system and to get your immune system to a point where you have greater immunity against the COVID-19. So with the the increasing spread that we're beginning to see, even if the version might be milder, it is important to protect yourself by getting the latest booster.
And just talking about the respiratory virus season, we've sort of got that, this combination, some RSV, some flu, COVID, still making people sick. What kind of things do you think really sort of warrant going, when we talk about respiratory illnesses, you need to probably see either urgent care or go to the emergency department?
Well, it all has to do with the severity of illness that you have. And so oftentimes I would say in adults or with the mild symptomatology, there is potentially no need to go to an emergency department. Now, with a child, that might be very different because of the predilection for RSV to really cause significant symptoms in children, for instance. And so when we think about it, it all has to do with your respiratory status and whether or not your breathing is okay and whether or not you are in distress. I mean, all of that will matter, and frankly speaking, will determine whether or not you should seek emergency care versus going to urgent care. So it all has to do with the severity of symptoms.
So if you're having difficulty breathing, if you're having extreme symptoms or extreme pain or fatigue, go to the ER.
Yes.
Yeah. Are you seeing? I mean, are ERs seeing a lot of that still?
Oh, absolutely. And I think you've heard it all over the news: the RSV, the flu season, and then now with COVID. And so this is a trifecta that we had anticipated would happen, and as you can see, has caused high levels of respiratory illnesses across the country. But we've seen this especially in children.
Talking a little bit about mental health in the emergency department, that's a challenge. What are some mental health emergencies that you think warrant going to the emergency department? Or can you talk a little bit about that?
So the mental health crisis in general is so significant, but I will say too, this has been going on for a very long time, and we've seen this in emergency departments across the country, the burden of mental illness and mental health issues, and frankly speaking, our healthcare system's lack of capacity to really handle the burden of mental health, especially the acute conditions that occur. Typically in an emergency department, the mental health issues that we tend to see oftentimes may be associated with substance abuse, but oftentimes can be associated with what we call suicidal ideations. People who have reached a point in their life where they're really considering ending their life. And when that happens very frequently, either a loved one or a law enforcement officer or maybe the paramedics might be called to have someone be transported to the emergency emergency department to be emergency evaluated because there is a concern that they could be harmful to themselves. And that is typically what we tend to see in these situations and circumstances. And they are tragic. They really are, because individuals at that point are really at their lowest point and are really navigating life's difficulties when it comes to that point. And so the emergency department is a place where we try to pull together the resources, both acutely in terms of emergent psychiatric evaluation, but all the other wraparound services that are going to be so important in helping someone through that initial crisis. And that's really critical. It is a burden that is actually growing. We know that we have a mental health crisis in this country. We know that it's something that is afflicting the young even more. We have issues around suicide. This has a lot to do also with weapons that people possess and all kinds of other things that really impact and is impacting what we've seen in emergency departments across the country for so long.
But just to normalize that, you see this all the time.
We see this all the time.
You can help at least put them in touch with resources, emergency resources that might be.
We can, but I will say this, that our health system needs to find other alternatives because the emergency department cannot just be the answer. And that's really been the issue for a very long time. The resources, I think, are still not there in sufficiency to be able to handle all of the issues that actually come through the emergency department when it comes to mental health. And so what happens is that there is a need not only just for the emergent care around psychiatric illnesses and mental health issues, but what's really important is how do you actually handle the chronic illnesses that occur and how do we prevent the cycle in terms of returning back to the emergency department for some of the same issues. So the issues of resources throughout our community is incredibly important, and we have to invest in that. And we have to invest not only in the resources, but we also have to invest in the practitioners, the people. We have a shortage of psychiatrists and mental health professionals in this country, and that's something that we have to really focus on as a community and as a society.
Okay, and Dean Tyndall, we have a question here from Tarika who says, how do you know the difference between an anxiety attack and a heart attack? Well, that can feel, the heart racing, That
is true, and I will tell you this, that oftentimes in the emergency department setting, anxiety can feel like a heart attack, and a heart attack can feel like anxiety, without question. How do you tell the difference between the two? Well, sometimes when you cannot, you need to seek care. Because neither of those issues are ones that are necessarily comfortable. We understand that if you are truly having a cardiac event, that those outcomes could certainly be worse. But a history of having anxiety is probably important to consider. A lot of times when people have anxiety, they know themselves. They know they're actually having an anxiety attack. But if you have risk factors for cardiac disease and you have chest pain, you have shortness of breath, and you feel anxious, this requires a call to 911 and a transport to the emergency department so that you could understand what actually might be happening.
Okay, and we had a poster who said, commented, and I just wanted maybe to offer you the option to weigh in on this, commented it was not safe to take the COVID-19 shots because they are causing heart issues. Can you address that?
So the way I address this is we have seen the data. The CDC has shown the data and developed the data. We've seen the studies that actually show that the benefit of taking the COVID-19 vaccine to everyone far outweighs any of the small risks that we actually see. We know that in any therapeutics that we actually deliver, there is a small amount of risk that actually occurs. But there is no question that that risk is significantly less than the tremendous benefits that actually occur when taking the COVID-19 vaccine. And the studies have demonstrated this over and over.
So I want to say thank you. I think it's a good place maybe to wrap it up, but thank you very much to Dr. Adrian Tyndall. He's the Dean of the Morehouse School of Medicine and also an emergency physician who took a lot of really, I think, good questions from you guys about medical emergencies and what to know and how to navigate the emergency department. So thank you for joining us for this live talk back. I hope we'll be able to have you back soon and do it again.
My pleasure, and thank you for having me.
Thanks, Dean Tyndall, and thank you guys for joining us.